Russ sent you.
It's time for the Russ Belville Show's Cannabis Q&A with Dr. Mitch Earlywine. Dr. Earlywine is a professor of psychology at the State University of New York at Albany and a leading author and researcher on cannabinoids and health, who pins the Ask Dr. Mitch column for High Times magazine. Get your questions ready in our live chat or call in to 971-533-7111 now.
Welcome back, everyone. Half past the hour. Joining us as usual on a Monday, we've got Dr. Mitch Earlywine on the line. How you doing, Dr. Mitch?
Cold.
I know you're about to get snowed under there, I believe.
It's looking a little scary.
Oh, my goodness. All right, well, batten down the hatches and take care of yourself. I want to make sure that we have you for the next few episodes as well. As we always do here on our Cannabis Q&A segment, we're taking live questions in our chat room. You can visit the chat room by going to 420radio.org and clicking on the green chat button. Give you a pop-up window where you can ask your questions, or you can do it the 20th century way and just give us a live call at 971-533-7111. We always open up by letting Dr. Mitch tell us the first word in cannabis science. So what's new, Dr. Mitch?
It's been a big week. We got confirmation on marijuana use being linked to low body mass index. More data suggesting cannabis is great for chronic pain, probably better than the opiates. Physicians group approving cannabis for children's illnesses. I'm not sure what you'd like to do first.
Well, you know, the big story that I covered in the news was the American Academy of Pediatrics. And one of the interesting takeaways from this, they came out with a new set of policies regarding medical marijuana use and marijuana legalization in general. And depending on which news source you read, it was good or bad. Like I read a few headlines that said American Academy of Pediatrics rejects legalization. And then I read another headline that says, American Academy of Pediatrics approves medical marijuana for children with severe illnesses. I mean, can you sort this out for us? What is the latest here on this study or this position from the pediatric doctors?
In truth, you got to kind of take it in context. These are folks who never said marijuana had any medical use, especially not for children. And this is them loosening up a little bit, saying marijuana could be moved from Schedule 1 to Schedule 2, which is hardly a big move and wouldn't, necessarily open up all the research we'd love to have. But coming from these guys, it's really saying a lot. So this took a big move on their part to just fess up that there may be medical utility for children. And despite their hemming and hawing, I feel like this is a real sign of the times that physicians are opening up their minds to the data, suggesting that, in fact, there are tons of situations where children could benefit from medical cannabis.
Yeah, it seems like in reading their response, it was a lot of, well, we don't have a lot of study on this. We don't know what it'll do. We do know that it's bad for kids and it should only be used as the medicine of last resort. But Dr. Mitch, given what we know about the side effects of some of these drugs commonly prescribed to kids that marijuana can replace in many cases, that almost seems cruel to have to wait to use the least harmful drug last.
It's sad but true, and and you think about the seizure data we've had, these really compelling individual cases where that's the kind of thing we've got to let everybody have access as quickly as possible, and not just to high CBD strains, but any form of cannabis that could be helpful. And then when you think about some of the Adderall use and these drugs that are strong stimulants that have the potential to inhibit growth and decrease appetite so badly that kids end up having to go off it in the summer just to, get a few pounds back on and things like that. This is still far from where we'd like to see it, but it definitely is progress from this group, and so that's, what we want to try to celebrate.
Yeah, the pediatricians also recommended that marijuana be decriminalized, that too many kids, especially minority kids, end up getting a criminal record, and that it's more of a public health issue to deal with their marijuana use. But they also warned against legalization, saying we don't want to see the same sort of marketing techniques used by alcohol and tobacco to addict another generation of kids. What do you think of this, stepping up to the line of legalization when it comes to this recommendation?
I understand the apprehension about commercialization, and I think that they need to understand that distinction. There's legalization and then there's commercialization. I'm, completely behind having cannabis have laws comparable to those set up for tobacco as far as advertising and things like that are concerned. And I feel like the underground market is so bad with carding and keeping, cannabis out of the hands of people who are really too young for recreational use. So we need to draw that line between legalization and commercialization and say legalization is definitely the way we want to go, but commercialization is something we want to keep a handle on so that, you're not seeing advertisements for cannabis on the Saturday morning cartoon shows.
We have a question from our chat room asking you to elaborate on low-dose medical use, where we talk about using just a puff or two at a time, an hour or two between doses, and why is that more effective? And how would you be able to find out your timing?
What's interesting is it has the advantage of decreasing any opportunity for developing tolerance. So what you end up doing is not only keeping your tolerance down so your sensitivity remains, but actually keeping your cannabis bill low. So in this little dabble do you sort of approach, you take as small a vaporized hit as you think is reasonable, and then literally wait a whole hour until you get the big chance for all your symptoms to disappear. And what a surprise, you're much less likely to develop tolerance. You save a whole lot more money, and then should your symptoms get worse because of the illness, you've got a bigger range for use of cannabis and increasing your dosage later on. And the possibility of negative consequences or any kind of cannabis-related problems is low anyway, but now it's particularly low. And that's a chance to, experiment with dosage just like we do with a whole lot of medications in the armament. So it's not that this is some kind of special deal with cannabis. We see this with a whole lot of over-the-counter and pharmaceutical drugs.
I know as people are trying to figure out what dosage works for them, they might be confused by the idea that they have to feel a high before anything medical is happening. Does the medical benefit happen before the high creeps in, or is that a good marker?
At least our evidence from some of the pain literature suggests that no. In fact, a lot of folks who have a change in subjective state to some strains, if they use even less than that, will actually see changes in some of their symptoms before they actually can detect it. So it sounds counterintuitive, but if you're willing to wait a little bit on a small dose, you'll actually find that at least with some of the pains that are related to pressure or swelling, you'll get an improvement in the symptom without any actual psychoactive effect.
Also, with respect to that dosage question, what about CBD oil? How would someone determine their dosage with a CBD oil, and would that CBD oil cause them to test positive on a workplace drug screen?
So it really depends on how pure and clean and THC-free that CBD oil is. But if it has basically less than 1% THC, it's not going to create a positive drug screen if you're taking it at reasonable doses. The thing with CBD is because it's not really psychoactive, you can start with usually these 10 milligram doses, which is what a lot of the gums contain and things like that. I realize they're out there. We're not sure about purity or things like that, but at least looking at what's been done in the lab, up to 60 milligrams, we've seen, in published research. And so, there are no real negative effects. It's not like you're going to OD on CBD or something like that. But to ease up on that until you get the symptom relief you want, and to understand, too, that this is a substance where it might take literally a couple weeks at, say, 60 milligrams for all the benefits to finally kick in, much like we see with a lot of medications or a lot of these sort of, like St. John's wort, safflower oil, these various other pharmaceuticals that are really basically herbs.
Okay. We have a great study that came out recently on the effect of daily pot smoking on the lungs, and it had to do with spirometric volume. Can you explain to our listeners what this study tells us?
It's intriguing because really this is all about how much lung air there is. How much air can your lungs hold? And this is looking at 20 joint years. So we're talking about people who really have an extensive experience and not detecting any changes in that full lung volume. The other measure that I often use, and the one that I've used in the vaporizer studies, is how much can you blow out in 1 second, and it's called FEV1, but it's basically forced expired volume. So how quickly can you blow out a whole lot of air? And that's a good measure of what kind of irritants are left in your respiratory system. And we're also seeing, at least among those who vaporize, this is not a big deal either. It's intriguing, too, because it really says that it's important to take good care of your lungs, but cannabis use and cannabis use only is really not a high-risk behavior as far as that's concerned.
Excellent news. We also have a study to look at out of Australia having to do with the use of cannabis for pain. What's the latest on that?
What I really love about this one is they've got a meaningful percentage of participants who self-report that cannabis is actually better for their pain than the opiates. And if you think about, somebody who's got a chronic pain condition where they're going to need some kind of pain-related medication pretty much every day over years and years, this is great news. You can develop cannabis tolerance, but if you keep your dosage low, it's unlikely. And the opiate tolerance is so rapid, and the side effects are so strange, including the never-discussed constipation, that this is a delight to see that we actually have people saying, no, cannabis is really the drug for me, and this is what keeps my pain down. And they're much less likely to, store these opiates, risk overdose, or any of those other problems that we see associated with long-term opiate use.
All right. Another study has come out regarding marijuana use and body weight. This one tracked the Inuit people of Nunavik, the northern territories of Canada. And as a native people and so rural and remote, they may not be as affected by, fast food marketing or other things. What can we learn from this study?
Well, what I love about this is really the third replication now we've had where basically cannabis users have lower BMIs than non-users. And it kind of tells you, in a sense, that this applies even to folks who aren't in the McDonald's world, as you've alluded here. I have a sort of pet theory that this is about, we all want a certain amount of pleasure in our lives, and that cannabis may provide some, or food may provide some. But clearly these folks are a healthy weight, but they're not overweight compared to the non-users. And these were folks who had not necessarily daily users or anything like that. They simply asked, have you used cannabis in the last 12 months? So this doesn't mean that cannabis is necessarily your new diet plan, but it does suggest that folks who are getting some of their pleasure from cannabis use may not be turning to food to get their pleasures.
All right. And in our final story, before we get to it, let me remind folks, if you didn't get a question in or you want to ask it privately, you can send it by email to 420research@gmail.com. And this last story is really kind of a tangent in a sense, but it does have to do with scientific integrity. I was forwarded a story about a researcher who had faked data. He had actually put in false diagrams or pictures in some data and was fired for that, but has now picked up a new job at the U.S. Patent and Trademark Office. And just in general, I wanted to get your take on, data fakery and shenanigans going on in the scientific world. How prevalent is that, and what should we be on the lookout for?
So what's funny is I was talking about this in my research methods class just last Friday. There's out-and-out flagrant, I made up the numbers and there were no data at all, and I feel like that is not all that common and often, found out. But there's also these kind of slippery, you measure 5 things, but you only report the 2 that were significant thing that seems to go on a little more often, and some folks don't understand actually some of the statistical techniques that they should be using versus some of the ones that they think are okay, like looking at the data and then saying, it's not quite significant, but let's run a few more, which really is not the way we want to do our research. And unfortunately, 70% of some researchers have suggested that, they would do that and didn't think it was a big deal. So that's why I'm constantly saying, we need replications, and anytime anything good or bad comes out about cannabis, I often caution that we want to see if it shows up in another data set before we really make too big a deal out of it.
All right. Well, Dr. Mitch, thank you so much for filling us in on the latest in cannabis science and keeping us all up to date on scientific integrity. Again, you can get your questions in directly to Dr. Mitch at 420research@gmail.com. Stay safe, Dr. Mitch. Grab a snow shovel, and we'll see you next week.
Go Seahawks.
Oh, no. No, not the Seahawks. Oh, it's not easy being a Packers fan these days.
Talk to you later.
See you, Dr. Mitch. All right, stay tuned. The anti-drug PSA of the day is next, and then a radical rant on the state of drug testing for welfare in the United States of America. You're listening to The Russ Belville Show.
You're tuned into the Russ Belville Show, the voice of the marijuana nation.